Hello everyone, I'm Dr. Neha Gupta from Mediworld Fertility. Today we are going to talk about vaccines that any lady should take before planning pregnancy. So when we talk about vaccines, there are a lot of vaccines which are given in childhood like mumps, measles, rubella, tetanus, diphtheria, pertussis, BCG for tuberculosis, optional vaccines like influenza vaccine or pneumococcal or meningococcal vaccines. These vaccines are mostly given during childhood. Now, if any couple comes to you and they are planning pregnancy, we should take a detailed history regarding their vaccination which they have done during their childhood. Before planning pregnancy, the most important vaccine that we want to talk about is rubella vaccine and HPV vaccine. So, rubella is a virus which can be transmitted from mother to the baby. If the lady is not immune to rubella, then and she gets the rubella virus during pregnancy, then this virus can be transmitted from mother to baby, and the baby can be born with lot of congenital abnormalities like hearing defects, some defects with vision, some anatomical defects. To reduce this, we should always check the rubella antibodies in their blood, which can be done through a simple blood test. And if the antibodies are not there, then a single shot of rubella vaccine can be given, which works for lifetime. Second vaccine that we want to talk about is HPV vaccine, the human papillomavirus vaccine. Now, HPV is a deadly virus. It is a virus which is around you, which is everywhere. It is mostly get exposed to HPV virus mostly during a sexual contact. So, according to National Immunization Schedule, now they have incorporated HPV vaccine in the immunization schedule where young girls as early as 9 years can get the vaccine. From 9 to 45 years is the recommended age group for HPV vaccination. The earlier we give it, the better it is. If we give the HPV vaccine before 14 years, we need only 2 shots of vaccine. If we give it after 14 years of age, we need 3 shots of vaccine. But once given, it leads to production of lot of antibodies in the blood. So later you are protected against the most deadly disease, that is cervical cancer or genital warts. There are a lot of benign conditions also which are caused by these HPV virus. So we have these vaccines available freely. If you are planning a pregnancy, ask your doctor. Ask if any vaccination is to be done before pregnancy. Once the lady conceives, these are live attenuated vaccines, they can't be given. But during pregnancy, we want to cover for tetanus vaccine. So tetanus toxoid is something that if we give to the mother, it gives passive immunity to the baby. So usually now, according to the new guidelines, the first shot of tetanus is given during the early second trimester, and booster dose of diphtheria, pertussis, and tetanus can be given in the early third trimester. So it passes on passive immunity to the baby during birth and during breastfeeding. So this is the vaccine which can be given during pregnancy. Please discuss with your doctor if you have any queries regarding vaccination before planning pregnancy or during pregnancy. I will be very happy to answer them. You can call on the given number or visit our website, fix up an appointment, come and meet us, or follow our videos to know more about such topics. Thank you so much.